Healthwatch Bradford and District is a small organisation, but the key to its success is that with statutory powers, it has real influence on health and social care services. We can hold them to account and make sure they're taking action.
Being part of Healthwatch is very important to me. It was one of the main reasons I wanted to get involved, to try and help people who may not be able to access services, or more to the point, raise concerns they have. And in this position, it's helped me to encourage some of those people to come forward. As chair of Healthwatch, I have a position on the Health and Wellbeing Board. It's one of the most influential strategic bodies across Bradford Council, so we're able to have a lot of influence in some of the decisions that affect the patients and citizens of Bradford. One of the really good pieces of work we did last year was Invisible at the Desk. We went out and spoke to over 600 patients to get their views about services they were receiving. The effects of that report, the influence of that report, is still ongoing this year.
Healthwatch is Invisible at the Desk report certainly resonated with us as GPs. We recognised that the patient had a problem accessing GPs, but we kind of felt we didn't really know what to do about it. Clearly we wanted to improve access to our services, but it was very difficult to know what to do about it. I think it was very useful in prompting the question of, well, is there something we can do about it, that rather than just say, well, that's the way it is. It was suggested that we invest in training for our receptionists to try and help them to see the problem from the patient point of view and enable them to get better access to the services that were there. Nearly every practice in the district has taken part in the training. Not every receptionist, but the majority of receptionists have attended the course. We were a little concerned that it might be seen to be teaching your grandmother to suck eggs, but receptionists generally have been very positive about it and not felt they'd been told how to do their job.
The Healthwatch team were really pleased that the CCGs decided to act on the feedback from Invisible at the Desk. We know that people's experience with frontline staff is really important, and the patient participation group members at the Grange practice in Allerton have already noticed the difference.
When you come in and you're feeling poorly and you go to that desk, it used to be, yes, no, there's no, and you didn't feel you were just anybody. And I think if they've got that little bit of care and, I don't know, the tone that they used to say things to a person, I think if you come over softer, it helps. So by having this training, I think now they do come across softer, and people are coming in with a smile on their face and going out with unless they're really poorly. I've noticed a big change, and as I say, people have definitely outside have done the same.